Now it's my privilege to invite Dr. Soumya Swaminathan for a plenary talk. Quick introduction about Dr. Swaminathan. A pediatrician from India, Dr. Swaminathan is a globally recognized researcher on TB and HIV and is currently the chief scientist at the WHO. She has over 3 decades of experience in clinical care and research. Dr. Swaminathan has served as Secretary of the Department of Health Research and Director General of the Indian Council of Medical Research and has published over 250 peer-reviewed publications and book chapters. In this chat, Dr. Swaminathan will share her perspectives on tackling the spread of COVID amongst India's poorest and the measures the government could be taking to protect the most vulnerable. I'm looking forward to hear her speak on the various aspects of public healthcare systems in India, our current readiness and vulnerabilities, and what must be done to build enduring resilience. Dr. Swaminathan, honored to have you join us, and over to you for the next 15 minutes. Thank you so much.
Thank you so much. And greetings to everyone who's listening in. I think this is a great initiative, first of all, to get different points of view, ideas and thoughts, especially on our Independence Day, as we celebrate 74 years of independence. And then we're looking ahead to a bright future. I think it's time really for the generation that we belong to, which is the post-independence generation who were born in free and independent India and had the benefits of growing up in a democracy with freedom to speak and act and a good education. We also need to give something back. And I think as people who have, at least I speak for myself, sharing our experiences and thoughts is probably a constructive contribution. Now, of course, we're living in this pandemic and everything is colored with the pandemic. And so it's really hard to think about anything because it's affected every aspect of life. Now, today, of course, we're focusing on public health. And I think one thing that this pandemic has done has completely brought to the center the importance of public health. And I think maybe that's been the only silver lining, that it has forced governments, political leaders, and the public to appreciate the key role played by both science and by public health. And we've also seen that those countries which have invested in the past on public health, on universal health coverage, on good surveillance systems, on good primary health care, were able to do better. And of course, there are many different pillars. When you talk about public health, there are pillars starting from the governance, how the cadre is set up and managed, so the whole management side of it, then the financing, how much of the services are free at the point of care, how much is the out-of-pocket expenses that people are facing, what are the supply chain and the logistics, the data systems, and very importantly, the human resources, the cadre of health professionals, starting from the village health workers, the volunteers like the Ashas in India, for example, the nurses, the doctors, and all the other functionaries we should not forget. We often think about doctors and nurses automatically, but we forget that you need lab technicians, you need physiotherapists, you need counselors and mental health specialists. You need a host of people managing the pharmacy, for example, pharmacists. So you need a host of paramedical staff to really be able to work as a team and deliver quality care. So again, the focus over the last few years has shifted from quantity to quality of services. And we've been expanding the package of essential health services. Countries which are investing heavily in universal health coverage are expanding the package of services. Now, we often talk about protection or health security being the other side of the coin is universal health coverage. So UHC and health security actually go together, because the investments that you make in the system actually serve both. And it's clear that for health security, you need an investment in advance. And one of the things, again, that's come to the fore is that while there have been many warnings about pandemics in the past, and of course, the world has seen, previous pandemics, of course, all due to influenza. Most countries didn't take this warnings very seriously till it's actually happened. But at least this gives an opportunity for us to build back stronger and better. I think India has done well in managing the pandemic so far, but the challenges are huge because of the population, the diversity, the heterogeneity of the health systems, the capacity of the health systems in different parts of the world, the type of populations, the overcrowding in the cities, and the lack of access to healthcare in many rural areas. All of these pose challenges, and therefore, I think whatever we do has to be innovative. It has to be flexible. It has to be based on science and data and evidence, and yet allow enough local uh, flexibility to be able to adapt to the local context and the circumstances. And one of the things that I know that India is planning to invest in heavily is data systems, and has been doing. We have the unique identification for each individual, the electronic health records, the plans for a national health stack, the National Health Assurance Authority, which has also working mostly digitally. So all of this actually is helping to build the backbone of a digital infrastructure, which would be really needed for the future of healthcare. And again, I think the pandemic has forced us to be quite innovative in the ways in which we communicate and conduct our day-to-day business. And so it's giving us a lot of insights into how we can leverage technology. So while I have been visiting some hospitals, while I have been here in India for the last few days, I was struck by the fact that people are really finding it very difficult to come to health facilities now because of lockdowns in a number of places, lack of public transportation, and the fear of going into hospitals. And so this is an opportunity really to invest heavily in telemedicine and use telemedicine in many different ways. One is the classical patient to doctor consultation. You do it on tele instead of doing it in person. But this could also be leveraged to do training and to do shared virtual appointments. So, for example, if there is a chronic disease clinic, which people are not able to access, people with hypertension or diabetes or heart disease who are on treatment and normally would come to the hospital every month or every 3 months for a checkup, it should be possible now to engage them, not only one-to-one, because that, of course, requires the same amount of time the doctor would provide for an in-person, but a shared appointment where you could have 10 or 20 people with diabetes joining in a session with a doctor, a specialist. And while he or she talks to one patient, the others are actually listening and to the questions and answers, and thereby also learning. And this has worked actually in several places. These experiments have been done to show that shared care actually, perhaps in some ways, offers advantages to individual one-to-one, except in cases, of course, where there's confidentiality issues and people may not like to reveal their status. But for many diseases, people don't mind actually discussing with others. And it's an opportunity to learn from how others are doing, also from your peers. And so I think innovations like that in the health system, and also being able to support and communicate with our frontline workers, whether they are ASHAs or VHNs or ANMs, to improve their performance, they need constant feedback. They need that loop, which tells them what they're doing right and what they're doing wrong. And that could be somebody based either at the primary health center or at the district hospital who does this. And again, it could be a shared platform where instead of the in-person meeting, they all connect through form learnings and experience. I think building as outlined in the National Health Policy 2017 is going to be very important. And very few states in India today have that. And that is critical because it provides you, again, a structure in order which you can be activated. It's, of course, doing its routine activities, but in the case of an outbreak, an epidemic, it can be promptly activated in order to provide a number of different services. Having trained field epidemiologists who know how to do outbreak investigation, who can not only detect an outbreak, but also investigate it and put in place a response. So detection, prevention, and response are the three pillars which form part of the international health regulations that all countries have signed up to, and which sort of guide the way in which we would strengthen the performance in that area. And again, I think this is a time to take a critical self-look at what we have done well, what are the gaps, and what we could do better. I mean, I think an incredible success story has been the fact that from no indigenous testing reagents and one lab that was able to do testing for COVID in January, we now have, I think, 1,500 or more labs across the country, and that most of the reagents are being indigenously manufactured. So it's possible when there's a challenge, we can also take it as an opportunity. But it needs a very holistic approach. A piecemeal approach is not going to work. And perhaps the last thing that point that I would like to speak about is the participation of communities and people. And I was very impressed when I went to Thailand to see their primary healthcare system and how the community really actively participates in providing feedback, in being very close to the local subcenter or the primary healthcare center, and also having gatherings like they have this People's Health Assembly every year, which starts from the local level, at the village, at the district level, and then goes all the way up to a huge National People's Health Assembly every year, where ordinary citizens come together to discuss their health problems and the solutions with staff from the Ministry of Health, and also with other political leaders like the elected representatives. So I think that's another area where we could strengthen and which would really help our primary healthcare system if we started involving the community, getting the feedback, having them participate in programs, because for many diseases we know that having a curative approach has limitations, especially the chronic diseases. We talk about non-communicable diseases. There's a limit to how much diagnosis and prevention you can do. It's like not turning off the tap, but only trying to control the level in the bucket without when you have a constant tap that's open and filling the bucket. So this is where prevention and risk factors and the other social determinants, environmental determinants, social determinants, economic determinants of health, they come into play. And that needs, again, a separate approach. And it's, again, this becomes an all-of-government approach where the health ministry or the health department actually become the stewards and the champions. But the actual implementation may be done by different ministries, whether it's road transport for road safety, whether it's the food and agriculture department for nutritious food, whether it is the women and child department who manages the schools, and health and education need to go together. So whether it's the finance department, which actually makes the taxes happen, taxes on tobacco, taxes on alcohol, taxes on unhealthy foods. So on the one hand, we have to strengthen our healthcare delivery system, including the human resources, and develop the public health cadre. And on the other hand, it's what individuals, behavior change can do. And at the community level, at the village level, or at the urban neighborhood level, what are the things that they can put in place, including water and sanitation and waste disposal and taking care of local water bodies and trying to reduce pollution. So that I feel would be the holistic approach as we look forward to new era and not only more financial investments, but more investments in health, leading to a healthier population for all Indians. Thank you very much.
Thank you so much, Dr. Swaminathan, for your rich and timely insights, which is also a great segue for our next segment. Thank you so much, Dr. Swaminathan.
Thank you.